Welcome to Please Me, the award-winning bilingual sexuality podcast bringing you bold conversations and big clit energy. As a female host in a male-dominated industry, I'm thrilled to announce that Please Me is the #1 ranked sexuality podcast in the USA and worldwide, covering topics on sexual health, intimacy, and sexual empowerment. I'm Eve, your host, on a journey from trauma to sexual liberation. Join me and my guests as we dive into conversations around orgasm equality, self-love, body positivity, and essential sex education. Let's reclaim pleasure and close the orgasm gap, one empowering conversation at a time. Last week, I brought on Genevieve Lejeune, founder of Skirt Club, the only global membership club dedicated to bisexual women. If you're bi-curious, bisexual, or exploring your sexual identity, this episode is for you. Tune in to hear what inspired Genevieve to create this exclusive upscale space for women to safely explore desire, connection, and community. Today, I'm introducing Becky Gleed to the show. She is an expert dedicated to perinatal and reproductive health, and we talk about fertility, IVF, and medically assisted reproduction, and how it can impact intimacy, relationships, and sexual connection. This is a very relatable conversation for anyone navigating fertility challenges or reproductive health, and I also share my own experience along the way. Hope you enjoy this episode. If you're ready to take your pleasure and your sexual health seriously, explore the Sexual Longevity Protocol, the private client blueprint for lifelong sexual pleasure, a self-paced course designed to support you long-term. And if you want to start gently, download the 30-day self-pleasure and body reconnection practices, a free daily guide to help you reconnect with your body and build pleasure, one day at a time. If you'd like to support the show and help keep these conversations around sexual health, intimacy, and pleasure free for everyone, join me on Patreon for ad-free episodes, early releases, and exclusive content. For more education, updates, and deeper insights, subscribe to my Substack newsletter. You can also join the Please Me Health Collective on SDC.com, a premier platform for the ethically non-monogamous community, including swingers, polyfolks, and more. Use code 37340 for a free trial and access to my community, plus my free monthly webinars. Follow me on Instagram at Please Me by Eve Creations for more. Please Me is for mature audiences, so sit back, relax, and surrender to the pleasure of Please Me.
Definitely. I'll come back to the point I made earlier of the birthing individual's health matters. I can underscore that a million times, that if it's affecting the mental health or physical health of the mom, that's going to affect the attachment, that's going to affect all sorts of how you show up and the quality of care for the baby. And so while we're putting so much weight and pressure on breastfeeding, remember the perspective that other things matter too. Can we give weight to that as well?
Ladies, let's get personal for a minute. What does your vaginal health routine look like? Because as we mature, our intimate self-care needs an upgrade. If hormone shifts have you feeling dry, less sensitive, or just not quite like yourself, I've got a simple 3-step protocol I'm loving. Every morning I use my lady pump to increase blood flow and wake up the lady bits. And yes, it comes with 3 attachments for all the sensations. Then I apply Shamelessly Aroused by Shameless Care, formulated with sildenafil, the active ingredient used in Viagra, to support stronger arousal, better lubrication, and more responsive orgasms. Pair that with a daily self-love ritual, and you've got a powerful daytime combo. At night, I use Parlor Games estrogen and progesterone creams to support healthy hormone levels and resilient vaginal tissue. Fewer oops moments when I sneeze, and way more confidence when intimacy calls. Dryness, decreased sensitivity, frequent UTIs, incontinence, low blood flow? These 3 upgrades can be a total game changer, because intimate health isn't indulgent. It's essential. And trust me, you'll feel the difference. Hello, and
USAA knows dynamic duos can save the day, like superheroes and sidekicks or auto and home insurance. With USAA, you can bundle your auto and home and save up to 10%. Tap the banner to learn more and get a quote at USAA.com/bundle. Restrictions apply.
Ryan Reynolds here from Mint Mobile with a message for everyone paying big wireless way too much. Please, for the love of everything good in this world, stop. With Mint, you can get premium wireless for just $15 a month. Of course, if you enjoy overpaying, no judgments, but that's weird. Okay, one judgment. Anyway, give it a try at mintmobile.com/switch.
Upfront payment of $45 for 3-month plan, equivalent to $15 per month required. Intro rate first 3 months only, then full price plan options available. Taxes and fees extra. See full terms at mintmobile.com.
Welcome to Please Me, the podcast that aims to destigmatize conversations about sex and sexual health by turning the sheets into our classroom. Today, I'm so excited to welcome Becky Gleed to the show. She is the host of Perinatal and Reproductive Perspectives podcast, which empowers individuals and professionals to navigate the complex world of perinatal and reproductive health. And today we're going to be talking about the impact on infertility and how that can affect our sex lives. So with all that being said, I want to welcome you, Becky, to the show. Thank you so much for being here today.
Thanks for having me. I'm excited to be here.
Me too. I'm super excited to have this conversation. Most specifically, because I can completely relate to having fertility issues. I had two experiences where I had 2 in vitro fertilization experiences. So I have 2 kids, and during that time, it was really difficult for our intimacy. And so I want to just talk a little bit about how this whole, experience can really affect the intimacy between partners, because suddenly you are not just having, intimacy for fun, right? Now you're trying to create another life. And if that's not working, it can cause a lot of stress and issues. So I would love your take on how this could really impact a couple's life.
There's so many layers here, and I'm excited to take a deep dive. But what I hear most often is it becomes so prescriptive and so perfunctory that it takes the fun out of it. It takes the foreplay piece when it's really, you have a doctor saying you've got to go Monday, Tuesday, Wednesday for your cycle. And, it does become, if somebody's going out of town, it creates stress or it creates some disruption in the routine. And then also what I hear is couples having dialogue around what more existentially, what does this mean between us? Of, 1/3 of infertility is unexplained. And so when you don't have answers, it can be really difficult in these, like, what does this mean for us in terms of compatibility? Sometimes it's internalized by one person of I'm to blame. And then it creates this whole different elephant in the room around how do we navigate this and have dialogue around something that's really uncomfortable to talk about. Those are some of the common topics that I hear from my seat. And then going into it's like we're talking injections, navigating a lot of newness and a lot of unknowns that can create a lot of anxiety and pressure. It's also for a couple often financially stressful. I've had some couples spend $250,000 and they have to schlep all the way to Manhattan from the DC area just for a reproductive immunologist consult. And that puts a whole level of different strain, especially right now. It's very, very expensive cost of living generally, but then to add on the stress of infertility treatment, you're lucky to have it covered through your health insurance, but if not, you're looking at a very costly, process. And then if it doesn't work, the grief that comes with now we're in so much debt, or we've spent our life savings or our retirement, and we haven't had a live birth.
Yes, that can all be so super stressful. And I know for me, I ended up in a marriage that became sexless over time, because, and I feel like when I look back and, I'm divorced, I'm no longer married to him, but I have 2 beautiful children to show for that relationship. So that was a blessing. And like I said, they were both in vitro. But I feel like, the reason that we got married was because we wanted to have children. We had been together for 6 years, and then we decided, hey, let's have kids, let's get married. So we got married to have the kids. And then suddenly, lo and behold, you can't have the kids. You know what I mean? And yes, it was a financial burden. Thank God that our insurance covered it. But there were certain aspects of it that were not covered, like freezing of, I think it was the sperm that he had to do, and also freezing of the eggs that also wasn't covered. So there were things that we had to pay for that were not cheap and that required payment over the course of time. It wasn't a one-time payment, but you had to keep those eggs frozen. So you had to pay on a monthly basis. So it was, an expense that does cause stress in a relationship. And so for us, I felt like when I looked back at our relationship and sort of like the downfall of our intimacy, I feel like it almost was like the beginning of the end, when we started this whole process and, like suddenly it becomes very medical and it's no longer a connection. You're just going to get injections here and injections there. And so it's a really difficult experience. Is this something that I'm curious to know how you got into this line of work? And I'd love to know a little bit about your medical history.
Yeah, of course. So I struggled with my first, and I did need some infertility support. And I'm so grateful for that because I've had 2 live births. I have 2 daughters, 12 and 7. But this was something that came up in the perinatal work that I was doing. It was so adjacent to the work that I was doing and then didn't become adjacent. Became very much part of the work because of secondary infertility folks that I would see. And then I started to become more involved in the American Society for Reproductive Medicine and realized, this is it really, as a provider, you need to have, some personal lens is helpful, but also meeting those ASRM guidelines as a provider is very important to have the training. So someone coming to you, they're not spending 10 sessions having to educate you on, these are the steps of, egg retrieval, or, some of the new research, Eve, is around getting an infertility diagnosis is akin to getting a cancer diagnosis in terms of psychological distress.
Wow.
The 2-week wait is, again, another thing we're realizing through research, that it is so psychologically distressing for the person going through it. So we're exploring, can we, advocate for fertility doulas, or can we, create programming to support partners going through this together? Or what does the person's social support look like? How can we make this experience less distressing if we know it's akin to a cancer diagnosis? And so that's a very real consideration from my seat of, I have the personal lens, but at the end of the day, we want to create space to help folks cope. I mean, even conversations I'm hearing around moral disagreements around, okay, we've used the eggs that we want to use. Do we discard? Do we donate?
Yes.
And couples, they disagree.
Of course.
How do you have those really tough conversations?
I want to just interject here with my personal experience with what you're talking about here, because we did disagree. And I knew that I did not want to have twins. That was something that I was adamant about. I was afraid to have twins. I'm a shorter person. I'm not a very big person. And I have some back issues that have been around. And, I was an older mom getting pregnant. And so I had a lot of concerns about my body and feeling well enough to be able to continue working throughout my pregnancy and just being healthy, throughout my pregnancy. And I just didn't think I could handle 2 babies. And, when it was time to do the transfer, there were actually 2 embryos that actually took, and it was a really big decision. And we ended up using both of them. And one of them didn't take, only one of them took. And so that was my first pregnancy and my first daughter. And so during the second time that we went through the whole process again, because we wanted to have 2 kids, we again had a disagreement about this. And, I had a bunch of eggs. I don't know. I can't remember how many there were. But unfortunately, only one was able to become an embryo. And that's my second daughter. So because of that, and I almost feel like the universe was listening to me, you know what I mean? And giving me what I needed, because I knew that I just didn't want to have twins. And then after that too, there was a disagreement about what we would do if the embryos, if we had multiple embryos and we had a second child, what would we do with the other ones? And he wanted to have them all. And I was like, no, I'm only having 2 kids. That's all you get from me, So again, the universe was listening and gave me just the one. And that is my second daughter. And I'm forever grateful. But I can totally relate to the fact that people would disagree about that, because of course you're going to have disagreements. Of course you're going to have different ideas, and that can cause a lot of stress on a relationship. You want to just jump in?
Yeah. And you can't have half an embryo. I think that's the tricky part, is sometimes with these gridlock issues, you can't live in California and DC, can't split yourself in half. And so that makes it very, very tricky in terms of having these difficult conversations. That's where a therapist can be very helpful, especially those who are, deemed infertility counselors. You also brought up something that I would love to highlight for your audience, which is the health of the birthing individual matters. Considering the back pain, considering the mental wellness, and something we just go in of, A, B, C, but what we don't always look at is this going to serve the birthing individual? And how do we consider, maybe it's not 4 transfers, maybe it's 2, maybe we look at how this will affect the health of the mom.
Yes, absolutely. That is so essential to think about that, because if you have medical conditions that, so many people do, that's why they have infertility issues, right? Especially on the women's side, if there's some issues, endometriosis, or any of the number of other things that can cause you to have infertility issues, right? And you have these medical issues and they're ongoing, you need to consider your body and your health and how you're going to feel during your pregnancy. And I know that for me, it was really important for me to be able to work for as long as I could. And I ended up working till the end of both of my pregnancies, 40 weeks, 41 weeks, even on my first one. So essential to make sure. And obviously I was very lucky and I was very healthy and I didn't have issues, but I ended up having issues after my pregnancies. I ended up with HELLP syndrome after both of my pregnancies. And I don't know if that's something that's common for women that are like older and getting pregnant in their older, years or not. But that was the case with me. And I thought I was going to die both times after my pregnancies. The pregnancy itself was like amazing. And then I gave birth and suddenly, boom, I'm back in the hospital, like on my deathbed practically, like just fighting for staying healthy and for my life.
Mm-hmm. I've been practicing for almost 20 years and I've only seen HELLP syndrome 3 times. It's just to give some context of, and it's very life-threatening. So I'm glad you're okay.
Well, thank you for saying that, because honestly, like I had to convince the doctors the second time around that it was HELLP syndrome, because I'm like, this is exactly how I felt the first time. And they're like, no, you have, you have you probably need gallbladder surgery. They wanted to take out my gallbladder. And I was laying there going, I have HELLP syndrome. I had it my first pregnancy. I literally feel exactly the same way as I did my first pregnancy. Look at all of this fluid retention. I weigh 20 pounds more than I did before while I was pregnant. Suddenly I'm like ballooned out and I already gave birth. So this is not normal. And, I had to really fight with the doctors to treat me for HELLP syndrome. And it was a battle. And so, sometimes I feel like it's so frustrating for women who are not really respected and who have to sort of fight with their doctors to get the care that they need. Do you see that in general in this particular, type of practice? Because even during the fertility treatments, there was one of the doctors that wanted to do it a certain way. And it ended up that I needed to go back to my original doctor from my first pregnancy. And he recommended sort of a more natural approach to fertility, where we were following my natural cycle as opposed to just using the medications to alter my cycle. I don't remember what it's called, but I do feel like women in particular need to really learn to advocate for themselves in any medical situation, but particularly in this one, because of, the fact that a lot of times we are not considered, our opinions are not considered. Do you want to just jump in on that? Because that just frustrates me more than anything.
It's super frustrating, and it can cause trauma. I don't say that lightly. And so that's why I kind of pointed back to the fertility doula. I would really love, as part of my practice, is highlighting the importance of a fertility doula who can go in and help you advocate. But I always tell individuals going into fertility treatment you can interview your doctor. You can also ask, hey, what would be some alternative treatment plans that you can present to me? If it's a hard, like, rigidity, maybe that person isn't the right person for you. You also, it's interesting because there's also a lot of splintered medical providers. For example, REs are reluctant to collaborate with RIs because they have such different approaches. And
Can you
so
tell me what that stands for?
An reproductive endocrinologist versus a reproductive immunologist, and they have different scopes, but they are reluctant, at least in my experience, and I could, others might have a different experience, that they don't play in the sandbox together. They have different approaches, different lenses. One is more immunology based, one is more endocrine based. And sometimes what I see is they're so different in their medical practice that collaboration becomes difficult. And so, for better or for worse, individuals will actually not tell their RE this is a symptom of the system, and they'll go see an RI, not tell the RI they're seeing an RE, simply because they know they won't collaborate. But in their heart of hearts, on the topic of advocacy and knowing their bodies, they know there might be an autoimmune issue or an inflammation issue or something that an RI would better treat. But they're not disclosing this because they know that they would be discontinued from treatment.
Wow.
Yeah. So this is a reality of what's happening. But absolutely, I had one case recently who has a history of sexual trauma, and she was doing a retrieval, and she was on the bed naked for about 20 minutes and telling me just how traumatizing that was for her. And we don't even ask, do you have a trauma history? How can we make this more psychologically safe? Or can we be a little bit flexible in how we approach the retrieval with individuals who have some trauma history or whatever's going on that would help them feel a little bit safer?
I love this example so much because, oftentimes we're just seen as like a patient, your body's there, you're here to do this like one procedure and, go ahead and lay naked on the bed, like not realizing that can really be traumatic for somebody. And I'll bring it back again to another experience that I had. I tend to have a lot of gynecological experiences now that we're chit-chatting here. But I remember the first time I had an ultrasound of my uterus, and this was before I had kids. I must have been in my late 20s, and I can't even remember why I was having this. I think it was because I had fibroids, and this was when they found that I had some fibroids. Luckily, mine were very small and they've never really gotten bigger, but they're still all there, And so the first time I went to get an ultrasound, of course, you have to drink like a massive amount of water, right? And so you're super uncomfortable because your bladder is like about to explode. And they have you like waiting in the waiting room, like drinking this water and like, don't call you back. And your, bladder's exploding and you're trying to hold it in, right? And then you get on the table or the bed, it's the plinth or whatever. And nobody had explained to me that this was an internal exam. I had no idea that I was going to have something that looked like a penis, right? Yeah. With a condom on it, because she threw a condom on there and she put it inside of me. And I had no idea. I'd never had an internal ultrasound before. I had never had it explained to me. She didn't even tell me that that's what was going to happen until she, inserted it. And I just laid there and quietly cried the whole time. And I don't even think she realized that I was crying the whole time, but I do have a history of trauma. And that was so traumatic. And I can't even tell you how much more it would have been like, it would have calmed my nervous system and made me feel so much more comfortable if she would have just taken a few minutes to explain the process and explain what she was going to do to me.
100%. And consent, we could take a whole deep dive into consent around that. But bottom line, yes, advocating for yourself and your needs of, I didn't know that, I'm going to need a couple days to process and talk to someone. You just to advocate for anyone listening who's going into this, you have every right to pause or to say stop or to reschedule your appointment or to ask for, additional instructions. It's okay to advocate for whatever you need.
Exactly. And which is why, such a big part of the purpose of this show is to teach women how to advocate for themselves. Because, through all of my experiences, I, really am passionate about teaching people how to advocate for themselves. Because I was in my early, my late 20s, and I didn't know what to say, and when you come from a history of abuse, you are shut down verbally. And so it's very hard to really put your foot down and say, no, you are not doing that to me, I would have said yes if she would have explained it. I just had no idea. I was not expecting to be quote unquote penetrated. And so I was just shocked, and so yeah, absolutely. Learning how to advocate for yourself, going to the doctor's office with a list of questions and being prepared. And I love the idea of an infertility doula coming along with you to those appointments so that you're not missing any of the important questions. Because a lot of times the information is so overwhelming and it's above your head, right? And so I have an attorney now, and every email that I get, I ask for an explanation of what it means. Because I'm like, this is like not terminology I'm familiar with. I don't know what that means. So please explain to me in layman's terms, And so having a doula, I think, is such an amazing, idea.
Yeah. And when we're in that limbic state, we really only hear about 3%. And so
wow.
Can I please record this conversation? Or if you're having that limbic response, it can look like it's not just fight, flight, or freeze, but there's another component which we don't talk about a lot, which is fawning, just going along with it, smiling. Yes, that's fine. That's another limbic response called fawning.
Okay. Mm-hmm.
That is based in trauma. It doesn't always look like that fight, flight, or freeze, but just being very agreeable when you may not actually be fully consenting.
Absolutely. These are all really amazing things to discuss and to understand if you're going through a process like this. And, fertility treatments can cause issues, with our, intimacy and even impact after the fact, right? And so when a person struggles with fertility, how can it impact them emotionally and psychologically in their health? And how can it impact their connection and intimacy?
That's a great question. Some of the more practical pieces that we don't always talk about, but the hormones can cause a lot of inflammation, and how you relate to your body during that process can be a bit jarring or upsetting or unfamiliar. So, and even the injection process of, I'm going to do this alone by myself because this doesn't feel great. Or if you've gained an automatic 10 pounds of inflammation, you may not be feeling super sexy. And then the psychological piece can do a number on you. If you're under that much stress, how in the world, are you going to maintain your libido or be relaxed enough to say, hey, let's hop in the bedroom and enjoy something? So it can be psychological. It can also be that feel so prescriptive as a couple that it just is like, okay, it's time to do this thing. And before you know it, it's not pleasurable. You're not orgasming, and it just feels like a chore. And so from that lens, it can be a lot.
Yes, and I love to talk about the orgasm gap that exists between men and women, right? Where, men are having orgasms most of the time and women are having much less orgasms than men are. And really understanding that, because I feel like if you don't understand that that is a phenomenon that happens across the board from like marriage all the way to hookups and like everything in between, you're not going to be able to close that orgasm gap for yourself. So really understanding what the orgasm gap is and then being able to advocate for yourself in the bedroom so that you can get your needs met by whatever that may be, more foreplay, or, using toys after the man finishes, or asking for the things that you need, that I think that a lot of times women in heterosexual relationships are not really very good at. We sort of assume that our partner is going to know exactly what to do and, how to turn us on. And that is not the case. We need to be communicating throughout the whole experience. You want to just jump in?
Yeah, I think with any life adjustment, it's an opportunity to pause and be curious and revisit your pleasure points, what turns you on. And you can do this individually, you can do this with your partner. So for the example in infertility, remember, you can always take a pause of curiosity and say, hey, maybe I'm going to avoid my stomach because I'm doing all of these injections, but I'm really going to focus on like clitoral stimulation or breasts or music or whatever you can incorporate to say, ooh, this is a new thing I'm going to be curious about and explore. And then you can say, hey, let's try something new and be curious and have fun with it. It doesn't have to feel so pressured.
Exactly. And creating those like new experiences, because novelty does get you excited and it gets you turned on. And so creating new and different experiences. And I love to think of the whole entire body as an erogenous zone. Everybody has certain points on their body that, turn you on, and some people are ticklish in that spot. And like, so you need to really explore. It's an exploration from partner to partner, and something that you can really incorporate to really learn what your partner's points are, and maybe not always focusing on penetrative sex and just focusing on pleasure and experiencing pleasure in your body in general. Because a lot of times when you are experiencing fertility issues, it just becomes, like you said, it becomes a chore. And what you don't want is for that to be your experience around sex that continues throughout your marriage. And then suddenly you end up in a sexless marriage like I did.
Yeah, absolutely. And I think too, there's different points that you can prep for. Like, well, first and foremost, don't underestimate emotional foreplay. That's, ongoing,
Yeah.
especially if someone's in a 2-week wait period, knowing, okay, we know we're going into something psychologically stressful. How do we get ahead of it so we can still enjoy the 9-day period? It's not really 2 weeks. It's more of like 9 or 10 days. And how do we want to approach it as a couple? Do we want to pee on the stick? Do we want to wait for the blood test? And how do we create love and space for intimacy, whether it's penetrative sex or just emotional foreplay or pleasure points? You get to decide. That's the beauty of it. It's what's going to feel good for you.
Absolutely. I want to talk about the other side of the fertility treatment, right? Once the mom has the baby and the baby's in the home and you are exhausted, right? And you are trying to, just survive and get those bottles cleaned and make sure that you have enough milk and you're pumping and you're this and you're that. And I remember like pumping, and it was so painful, and breastfeeding was so painful initially. And I felt like I did all the studying and knew exactly what to do, and then it all went wrong anyway, And for me, it took me 4 months of every day saying, I'm going to do it for one more day, and I'm going to see how I feel tomorrow, and I'm going to do it for one more day, because it was painful for 4 months. And then finally it got to the point where I was like, okay, I got this down. I can do this. But it took me 4 months. And a lot of people don't make it that long, And so, you want to just jump in about breastfeeding too, because that's just a whole nother animal, right? I wasn't planning on talking about that, but I think it's worth like discussing a little bit.
Yeah, there's a lot of points around in the lens from sex or intimacy or pleasure I want to make sure we're
Yeah,
capturing.
so just like, the pressure that a woman feels, and that like parental guilt that is just like injected into you as a parent, that you feel if you don't do, what is technically, the best for the baby, right? And so I would love to hear your take on that.
Definitely. I'll come back to the point I made earlier of the birthing individual's health matters. I can like underscore that a million times, that if it's affecting the mental health or physical health of the mom, that's going to affect the attachment. That's going to affect all sorts of how you show up and the quality of care for the baby. And so while we're putting so much weight and pressure on breastfeeding, remember the perspective that other things matter too. Can we give weight to that as well? And so just remembering the mental health, and are they resourced? Are they supported in the way that they need to be? But also if you've had, I was there too with my second, I had just like back bending pain. I had a crack in one of my nipples, and it took me like 2 months to heal from it. It was horrific pain. And unless you've been in that type of pain, you don't really realize the impact that it has on you. So it's okay to take care of yourself. The other piece, if I do a segue more around sex, intimacy, pleasure, it's like not the sexiest thing to be leaking breast milk while you are being intimate with your partner. And so that's another thing, is like, how do we have fun with this or make this more comfortable, or, just name it like, well, this thing happened again. Because that's a reality that I don't think a lot of people talk about outside of the therapy room, is this was super embarrassing, or I had feelings that came up around this, or we had to stop and pause because baby was crying at 2:00 in the morning when we're trying to be intimate, and I had to breastfeed, and then it kind of killed the vibe. So it can be disruptive in the same breath. But I just come back to moms matter. Like, be kind and gentle with, if a mom's struggling to breastfeed and that's a wrap for her, trust her judgment.
100%. Because I think that almost every single mom that I know of, I mean, I have met a couple people that are like, that's not happening, I'm not going to breastfeed. And I already know that from the beginning. Some people they just know. But I think for the most part, the majority of women do want to do it. They understand that the benefits of it and they want to do it. And they understand that there's a connection, bonding that happens, but it is a very difficult thing to do. It's not an easy thing. Same thing with me. I don't know why, but I put like the pads on even before I started having any milk. And so I put the pads on, and then when I went to take it off, it was stuck to my nipple. And so like it like ripped off all my skin, and it took so long to heal from that. And again, like your crack, it was so freaking painful. And so, so definitely. And then of course, like when you hear, like if you're in the middle of an intimate time and you hear your baby crying, that just makes you like let down your milk. And so, yes, you can have these issues where you're like trying to get intimate and then suddenly like you're leaking milk, right? It can be embarrassing. It also can be really fun and sexy too. So, trying to reframe it, and, it is a kink out there that a lot of men like, to taste that milk. So not to say that that is something that everybody should do, but being open-minded about it. You know what I mean?
Absolutely. Yeah. I think it was a level of desperation with breastfeeding. I look back, I'm like, I should have just been a little bit more, open and flexible, but I went to like a compound pharmacy that I heard about in Canada that did an antifungal steroid, it was a whole thing, but I was glad for it. My crack did heal. Okay. And it got better, but those 2 months were hell. It was really, really hard.
Yes. And so anytime that I hear that a woman stops, trying to breastfeed, I can fully understand. It is a very personal decision. And if that's you out there, if you choose to stop, that's okay. And not to feel that parental guilt, that parental guilt is a real issue. And I just remember feeling it so strongly when I was a first time parent. And you don't have to feel that, you're doing everything that you can, that's, best for your child. And so really throwing that shame out the window. Just like I talk about shame around sexuality, we were talking today about shame around not being able to breastfeed, and that's okay.
There's so much guilt that comes with motherhood and with our bodies and expectations. It's like, can we just not do one more thing that induces guilt? We have plenty of other things to feel guilty about. I love that we're giving space to this today.
Me too. Thank you so much for, being willing to like really dive deep into like all of these really difficult, conversations. Ladies, whether you are just starting your menopause journey or well into it and have questions about hormone replacement therapy, you're not alone. Many women experience vaginal dryness, decreased sensitivity, and urinary incontinence, like leaking when you sneeze, laugh, or exercise. These symptoms can be frustrating and limiting, but they are also very treatable. I experienced this myself and decided to try Parlor Game's topical estrogen and progesterone creams. Within 1 month of consistent use, my incontinence completely resolved. Topical estrogen helps restore tissue health, improve sensitivity, and support bladder control, while topical progesterone supports hormonal balance. If you are ready to stop suffering in silence, check the show notes for the link to Silky Peach, the topical estrogen cream, and Vibrant Third, the topical progesterone cream. I feel relieved and confident again, and I know you can too. If you've ever wished sex could feel more connected, more intense, or honestly just more fun, you need to check out Shameless Care. They're a telemedicine company built entirely around sexual health, real doctors, real prescriptions, and products that actually work. Like Shameless Chemistry, their oxytocin plus tadalafil blend that deepens connection and boosts arousal. Or Shamelessly Aroused, a topical cream with the active ingredient found in men's ED medication, increasing blood flow exactly where it counts. Every order includes a short video introduction from your doctor, transparent pricing, and no subscriptions ever. Just real, sex-positive healthcare that delivers results. Because you're a Please Me listener, you can use coupon code PLEASEME for $15 off your order of any product on the Shameless Care website. Use the code PLEASEME, that's PLEASEME, at checkout to claim your $15 off. Again, that's shamelesscare.com, code PLEASEME. Because great sex shouldn't be complicated. It should be shameless. This episode is sponsored by Shameless Care. So the next question I have for you is, what is postpartum psychosis?
Yeah, postpartum psychosis is a rare condition, but it's an emergency.
Okay.
And it's when the birthing individual develops pretty rapidly psychotic symptoms. They lose touch with reality, whether in the form of hallucinations, hearing things, seeing things, smelling things, feeling things that are not there, or a fixed belief, which we call a delusion. For example, believing that your baby is the devil and that you need to withhold food from the baby. Those are some examples of postpartum depression. Again, it's considered an emergency. You need to get right to the hospital. If a loved one sees this, you need to get them emergency help, because it is a very dangerous prognosis if left untreated. So we do, I've seen a few step downs. I also worked in emergency psychiatric centers about a decade ago, where I saw some moms, and these, one was an attorney, one was a medical professional herself, and just floridly psychotic. One was kind of a manic psychotic episode, but it's a serious condition. It happens about 1 every 1,000 birthing individuals.
Okay, so it's not very common, but still happens quite a lot,
Yeah.
And so you mentioned that it was like a part of postpartum depression. So is this like like one of the branches of postpartum depression, or something that can happen if you have postpartum depression? Because not everybody that has postpartum depression experiences this severe psychosis, right?
Yeah, so there's actually a conversation right now in the psychiatry field to try to advocate as a standalone diagnosis that
Okay.
postpartum psychosis as opposed to postpartum, like a psychotic manic episode, which is under the umbrella of bipolarity. And then there's also postpartum depression with psychotic features. And so, I think in a year or two, we'll start to see it as a standalone, but diagnostically right now it's more of under the umbrella of a bipolarity or delusional disorder or depression with psychotic features.
Got it. Okay. So, what's amazing to me about the fertility industry in general, and you're talking about just, develop the way that medicine develops here too. And is that it's a newer medical treatment, right? And I remember just from, the advancements from my first child to my second child in those 2 years, they learned how to freeze the embryos. I think it was initially they wouldn't survive, right? The way that they were freezing them initially, but then they learned that they could freeze, dry freeze them or something like that. I think it was. And suddenly they could, they were more viable and they would be fine with, being frozen. And actually my second daughter was frozen because when I went for my appointment, I ended up having a cyst on my ovary. And so they couldn't do the implantation. So I had to wait until I had another cycle and for that cyst to go away. And so she was actually frozen. And I remember having the conversation because after my first pregnancy, at that time, freezing was not a good option. And then after the second one, it was. So it's just amazing how medicine is just, year by year, improving on itself. You want to
Absolutely. Yeah. I mean, I went to Athens, Greece a couple years ago to see the cutting edges and just how they're washing sperm, trying to get the most mobile, the healthiest sperm. The technology just in the sperm washing is phenomenal. If you look at some of the newer genetic testing that they can do, it is really, it creates a lot of hope for me. And then this intersection between the medical and the psych component is, as I talk to more reproductive endocrinologists and really advocating, at least in the Mid-Atlantic, have you considered bringing on a psychologist, or do you have a referral list for infertility counselors that can support your patients while they're going through this? Are you familiar with some of the psych research that's coming out? I'm experiencing more and more like soft collaboration where, and I also have to remember that they are so burnt out. The demand and the amount of patients coming for infertility treatment, we also have to be kind to the physicians that they are also overworked. So they don't always have the time or the resources to thoughtfully refer out or to provide that compassion because they're burnt out too. So I like to remember that lens. But I have a lot of hope for innovations in the field that it'll just continue to improve. And this is a global issue. This isn't just unique to the States, but it's a global issue. It affects people across the globe.
Absolutely. And it really is a miracle, to be able to have a child when you have infertility. It really is a miracle. So I appreciate the work that you do. And I would love to jump now into our role play.
Let's do it.
Yes, let's do it. So we are going to go ahead and just get started. We're going to pretend that we're a couple and we're going to be introducing something new into the bedroom. So with all of that being said, do you have any questions before we get started?
Let's have fun. This is an exercise.
Most of the guests enjoy this part of the show. So let's go for it. Okay, here we go. And action. Hey, Becky.
Hey, Eve.
So we have some talking to do.
About?
Well, I really wanted to connect with you today. And I wanted to, do some fun stuff in the bedroom. And I was hoping that you had some new ideas because I really just want to work on connecting better with you, especially because we're going through all of this infertility treatment. And it's just really hard to, connect on a physical level with you, and of course, emotionally as well. And so I just wanted to like do something a little bit different. And I'd love to like ask you if you have any ideas that you would like to try or something new that you'd like to do to like just make our intimate time even more amazing.
Yeah, it's funny you should say that because I had a similar idea. I've been so stressed out that I went and saw a reproductive acupuncturist, and I'm feeling a lot more relaxed. And I happen to have this song that is called Sensitive Subject that I thought I would share with you later.
Ooh, okay. We can put it on repeat.
Let's put it on repeat. And she has some other songs, but she talks about this other woman.
Okay, tell me about like the lyrics a little bit. I'm curious to know what attracted you to this particular song, and like what kind of, is it like a slow song, or is it, more upbeat?
Well, I'm the sensitive subject, and
Okay.
this is someone that you used to be with, that you don't have children with and never pursue children with. So she's going to be affected by the fact that we're making a baby. And this song has some other songs I'll share with you later that might be helpful in the bedroom.
Wow. Okay. So it's hitting a nerve emotionally when you listen to it.
Oh, yeah. And you would know.
Well, why don't we go up to the bedroom and just, get under the covers and, maybe hold hands or snuggle, and let's listen to it together. And I would love to have a conversation with you on the other side of how it's really like making you feel. And let's talk about it, because I feel like sometimes, things like a song or something that, you read, or maybe even like a reel that you see on Instagram or whatever, can really trigger some things that help us to like communicate in a more deep way. So do you want to try that?
Let's try it. And maybe there's less talking and more doing or exploring, and then we can see what comes up.
I love that idea. All right,
Yeah.
Let's go.
Let's go. Maybe Alexa can help.
Yes, Alexa will help. And scene.
Love it.
So yes, asking for what you need, people, asking for what you need is so essential in the bedroom. And if you are holding all of that in, if you do see something that is triggering to you, or that is bringing up some emotion for you, or that it is inspiring to you, share that with your partner, because they need inspiration too.
Yeah. And remember, the other side of this is pleasure can feel really good. Pleasure can induce oxytocin, which is a great antidote to stress and anxiety. That, remember, the other side is feeling really good. And that's, don't lose sight that it's not going to just be all this heaviness, discomfort. The point is to enjoy and to feel good and pleasure. So don't forget that.
Absolutely. I 100% agree. And my show is called Please Me. So I love talking about pleasure. So with that being said, I want to make sure that my listeners can find you. Where can we find you?
My website is Perinatal, reproductivewellness.com. You can also find my book series on Amazon, Barnes & Noble, my website, any major bookstore. And then I also have a podcast, which is on all platforms, primarily Spotify and Apple. It's called Perinatal and Reproductive Perspectives. I hope, Eve, you'll come on the show.
I would love to. Thank you so much for the invitation. Absolutely. I will have to talk about that offline.
Absolutely.
And so I want to make sure that my listeners can also find me. of course, my website is pleaseme.online. And if you're out there listening, I've lately been checking my stats, and I'm not a big person on checking all of the details of my stats, but I have found that over 70% of people are listening to this show and they have not hit subscribe or follow. So if that's you out there and you've listened to my show a few times and you haven't followed or subscribed, please hit the follow or subscribe button. And if you like this episode or any other episode that you listen to, please leave a message for me. Leave some comments, and I answer all of my comments. It is me, not somebody else doing that. I'd love to hear from you and continue that conversation. With all of that being said, I want to just make sure also that you know about something new on my website. It is a 30-day daily self-pleasure and body reconnection practice. So if you're interested in that tool, it is now on my website. So you can go onto my website and download it and start your 30-day daily self-pleasure practice. That's a present from me to you. And again, Becky, thank you so much for being on the show today. This has been such a great episode. Thank you so much.
Thanks for having me.
Until next time, everyone. Are you looking for a sexy date? Look no further than SDC.com. SDC.com is the premier ethically non-monogamous website that is worldwide. It also hosts a wealth of information on sexuality and sexual health, and I host a free live webinar monthly on the site. You can use code 37340 for a free trial membership on me, and be sure to reach out on the site and say hello. I want to personally invite you to join me on Patreon for ad-free listening, bonus episodes, and early releases. Already there is a lot of bonus content on there with many webinars that I've done in the past and a show that I've never released to the public before. My show is completely self-funded, and when you are able to support me in this way, I'm able to spread my message of body positivity, self-love, and women's empowerment, and empowerment in general around sexuality around the globe. And so with that being said, I appreciate everyone who has already joined Patreon. And if you've thought about joining, now's your nudge to do so.